There are many hospitals in New York City that have closed their doors. One was Victory Memorial Hospital. The second one is Long Island College Hospital. They actually proceeded first with closing their labor and delivery. That was the most costly department. And now they're actually closing the hospital. And there's St. Vincent's Hospital there for many, many years. And unfortunately, it closed its doors several years ago due to increasing liability costs that they could not keep up with. Where will these patients go to? Who will pick up the extra work, and how will those hospitals manage with the extra patients? My name is Jacqueline Villalobos. I'm a practicing OBGYN, and my office is in Cypress, Texas. When the patients wonder why I relocated to Houston from New York City, I am very honest, and I let them know. I relocated because Texas has tort reform. My associate and I were paying $168,000 each for our liability insurance. And every year you would receive a letter stating that there could be a chance of a 5 to a 20% increase in the rates. My liability premiums in Houston are approximately 20% of what I was paying in New York. It was not easy to leave New York. Obviously my family is there, and I had made, over the 10 years, I had made connections and relationships with my patients. I had seen them graduate high school, go to college, marriage, children. These are very difficult to leave behind. But the most important part is that I had made relationships, and it was such a difficult decision that I actually put it in writing. And I sent a letter to my patients letting them know that it was impossible for me to keep my doors open due to the hefty price of my liability premiums. We sent this letter out a few months before I closed my practice. And the phone calls that I received were immense, and they all said the same thing. Dr. Villalobos, we had no idea that you have to pay so much. Is there something we can do? And I said, well, write a letter. Write letters to your congressman. Write as many as you can, because I have to make the decision based on my liability premiums. Not because I don't want to stay here, not because I want to leave my family behind and move my children and my family across the country, but I want to continue being a doctor. I don't know how to do anything else. And the crisis in the liability premiums was exorbitant. You know, I'm not just one-sided. I'm not just saying, let's lower medical liability premiums so the doctors don't have to pay so much so that our profit margin can increase. It's definitely not about that. There's also the patient. The patient's the most important thing. I mean, this is why we become doctors, so that we are able to take care of our patients. They want to come to the doctor's office and be heard, and for us to listen to their concerns. And they want to have that time and that relationship. But if there's less doctors and there's more patients, that time becomes smaller. How can we approach our young population and tell them, be a doctor? Be a doctor. You'll put all these hours in. You'll have to work this hard because this is what you want to do. But at the end of the day, your idea of opening up an office and listening to someone for hours, it's not going to be available. Why? The overhead is just tremendous. Sorry. Tort reform has allowed me in Texas to be the doctor that I dreamed of being when I was 7 years old, to sit with my patients, to teach them, and to improve their care. Tort reform is not just for the physician. It is for everyone we care for. At the end of the day, the benefit we will see all around us, and we will see for the years to come.